there's been all this hype about cases. So in Ontario in September, they had the media reported on 10,000 new cases. 10,000, okay? And in October so far, I think we're at another 10,000 new cases. The problem with that word is that, as any experienced doctor will tell you, a case typically refers to somebody who's actually sick.
Right.
Having trace elements when you're perfectly healthy and you have no symptoms, having some trace element of something or other in your body and you're not sick, usually that's not a case. But the media don't report on this, right? They talk about cases as though these are sick people, and that creates a lot of fear and panic. Let's contrast the case numbers with the death numbers. So in September, you have 10,000 new cases in Ontario, which are now the justification for the more recent round of lockdowns, which are violations of our human rights, our human dignity, our charter freedoms to move and travel and assemble and associate and worship and so on. 10,000 cases in Ontario, 37 deaths. Again, every one of those 37 deaths is sad and tragic, but no less sad and tragic than the other 10,000 deaths that also happened in September. Right now we have some, depending on which province, you've got churches, mosques, synagogues, restaurants, meetings of various kinds. The government is asking you to list the names and emails and phone numbers of those who attended. Now, it's not in the name of some ideology, we're not for the sake of the workers' paradise or anything like that, but now it's in the name of, protecting grandma and public health, and how dare you be so selfish. So the pretext changes, but the violation of rights does not. And governments never violate your rights without putting forward, we're fighting terrorism, or it's national security, or don't you know we're in a state of war?